Hi friends, it's your friend Rashi, and this is not Caroline, this is my friend Dana Liconi. She is with Anti-Age Institute, and I wanted to bring her on because can we just do a tight shot on her, how fabulous she looks? She is in her 60s. And one thing that I think can resonate with all of us is the fact that we're all aging. And everyone's story is different. Everyone wants to look younger. And I was talking with Dana, she was telling me how there's more and more people that like 30 and younger that want to go ahead and do preventative things to look younger. And it doesn't necessarily have to be like you're in your 70s or 80s and now you're trying to like figure out what to do to look a lot younger. You can be younger too, trying to prevent a lot of things. So what kind of, because your husband, Dr. Richard Liconi, he's actually trained in emergency medicine.
He is.
And so what got you guys to start this? Because it's been since 1997 that you've had it.
Oh, I know. It's interesting how it started. We started into wellness. As I was starting to go through perimenopause, his mother was going through menopause, we started going to these anti-aging conferences. And there was a doctor, Dr. Mark Bailey from Canada. He came to speak at one of our conferences and said, we're putting together a seminar in Canada to get doctors trained in the U.S. for Botox and fillers. Would you guys like to join us? So when we went out there, we were out there with all the Hollywood doctors getting trained.
Wow.
So we were the first, and one of the first in the United States to practice.
So did you feel like with perimenopause, I mean, I'm 38 and women can start experiencing it at this age.
That's about the time.
Yes, and so we were just showing some video of your website there. What made you feel like, because you really connect to so many people and you have people on your staff that are of all ages,
right.
And what made you want to just delve into this and what makes, how has your journey been being on this path?
I mean, it's been great. It really, it's healthy aging, it's wellness, and the cosmetic thing just kind of fell into it because we were already seeing bioidentical hormone patients. I was the very first patient, and I started at 38.
Wow.
On just like basic like progesterone and a little testosterone, and that was it, just to keep my levels where they were at a healthy level. And then all of a sudden, you know, cosmetics, hit the market, and everyone used to say, "What are you all doing over there? What kind of monkey business?" And now it's everywhere.
Yes, and it is, and that's one of the reasons also I wanted you to be here is because it's so intimidating to so many people. When I got into the business as well, and came to Houston, obviously there's a lot more eyes on me, and I had never thought about Botox or anything like that. But I get Botox, I get filler, and I came to find out just how not intimidating it is.
Right.
So what is the process of actually getting it done? And I know we're going to talk more about what you should look out for, but how simple is it to just go to a place, a reputable place that's also overseen by a medical doctor, right?
Yeah, I think it's very important to really do your research before you go somewhere. If the price is too good to be true, it probably is.
Yes.
A lot of the manufacturers will have a website you can go on to make sure that it's an FDA-approved product, that it is a reputable clinic, that they're certified, and it really is. These products are so safe if it's done right, and if it's done with the right FDA-approved products. So there's really nothing to fear. People come in, you know, their first time and they're nervous, they're scared. But
right.
The minute that they meet us, they see that we're not overdone. All my staff looks normal.
Right.
We like the normal, not the overinflated
yes.
look. And
if we can show that video again of the website, you can see some of the people that work with her, which is also one of the things you can look out for, because if you see someone and you go to a medical spa and they're not looking right, just go away.
Well, I mean, even now today, there's something we call a dysmorphic disorder, where even the injectors themselves want that overblown look.
Yes.
And they do that to their patients, and patients come in asking for it, and because it's our reputation to make you look normal, make you look right, we actually will turn people away. We're like, this is really, we do facial balancing.
Yes, and that's huge, facial balancing, and not overdoing it. That's a lot of your staff right there.
And no one's overdone.
No.
They all look natural.
Yes, and tell me about the amount of cases that you see where people have need fixing because they've gone to somebody or they've been ripped off because people either dilute the Botox or they're using bad things. I mean,
we see it all the time. I mean, it's a couple times a week. We'll get someone that will either call us up, send us pictures, or they'll come in and they're like, "Can you dissolve this? Look what look what happened." And just for example, the lady the other day, she injected a $25 product into someone that was foreign.
Oh wow!
And we don't know what it is, so we can't really help these people. So,
Yes.
You really have to do your own research. I mean, medical spas are extremely safe, but there are some bad people out there doing bad things, and
Yes.
and there's a lot of counterfeit. So.
There definitely is. And we talk about this on the news so often that it makes our newscast because people have been arrested. And coming up right after the break, we're actually going to tell you about the most recent one where someone was arrested. And it's crazy what these people paid to get done to their face and what actually happened. And we're going to get Dana's take on it. We'll be right back. Hi friends, welcome back. We're here with my friend Dana Liconi, who is with Anti-Aging, Institute of Anti-Aging, or do we call it Anti-Aging Institute?
Anti-Age Institute. We just rebranded.
Okay, yes. They've been in the business for more than 2 decades, so they've rebranded a couple times, and this is the latest one.
This is the latest one.
You have to check out their website because it looks so good. It's brand new and it launched too. Yes. And we were just talking about aging. Everybody is aging right now as we speak, and everyone's journey is unique. And people more now than ever, and this is according to experts, are turning to anti-aging techniques, the most common one being Botox, fillers. Those are obviously
lasers.
Non-surgical. Yes, lasers as well. So we're going to talk about and this happens all the time in the news where we are talking about the people who have been arrested because people have injected petroleum, you were saying, or different things from abroad that are just...
You don't know what it is. It could be silicone. It could be...
You just don't know. And it's happening right here in Houston. So I wanted to tell you about the latest report that we had. More and more victims coming forward in this case of illegal lip injections. There was a woman who's facing a felony charge accused of injecting lip filler without a license. And we now know 7 total victims have reached out to law enforcement. So take a look. Abs Aesthetic, it looks like a legit business, and this is where prosecutors say they were definitely operating. Police were investigating this business for a separate financial crime. This is who was arrested. They realized the services they were offering, dug into the medical licensing through the spa, and it looks, chic and professional. But the disturbing detail is that they have no idea what was being injected into the patients. The products they found have been shipped to the FDA for testing. So if you have a license to do this kind of work in the state of Texas, that's actually public record, which you can look up. And Dana was telling about a company that actually you can look up as well.
Well, any manufacturer that makes fillers, you can go onto their website, make sure it's FDA approved, and you can also find your clinic or physician or injector under their website.
And that's what you're looking at here. And LA is one of them, right?
Well, this is Allergan.
Allergan, okay.
Right, yeah, these are Allergan products. These are Restylane products.
Okay.
But what's important, whenever you go to, do you want me to talk about, like when you go to a clinic?
Yes.
It's important to have your injector show you the box that it's in, look at the label to make sure it's FDA approved, look at the expiration date on them. And
this is, I might feel kind of weird asking them, can I see the box? But that should be normal,
know what?
right?
We appreciate that.
Oh, okay.
We like to educate, and people that are doing things right, which most people are, we want to educate. And
that's
because there are some bad apples out there, it gives us all a bad name, which isn't fair. So we want to show you. And all first-time patients that come in the office, we show them exactly what they're getting. Everything's pre-packaged, it's sterile. Like your Botox has a hologram on it. If it doesn't look like this, it's not the real thing. So it's always important to ask your injector, do they have a medical director? Is it FDA approved? And to see the product itself before it's injected. And you also want to know what they have. Like a lot of ladies will come in and it doesn't look right. I'm like, well, what did you have injected? And they're like, I don't know. So it's important to ask questions.
So then what do you guys do when you don't know what's in their face or their lips.
There's not a lot we can do. You know, we have, let's say that if someone was injected with what we call hyaluronic acid, that's these these are the safest fillers on the market. We can break it down. If for some reason, like it shifts for whatever reason, you can dissolve it instantly. And we want you to look perfect and not have any bumps or anything. But sometimes, kind of like what happened with that lady, if you get something injected that's not FDA approved, we don't know what it is. If you don't know what it is and you don't know what they injected, there's not a way we can break it down. So that's usually a surgical procedure if a surgeon will even touch you, because it becomes a legal issue at some point.
Yes. So if you have petroleum in your face, I mean, there's nothing to
silicone.
Oh my gosh.
You know, silicone stays.
Yes.
You know, forever. It shifts.
So when you talk to those people that come to you, you just are like, I can't help you, right?
I mean, if I know that they went to a reputable place.
Oh, that's different, right?
That's different. Then we will work with them and help break it down and do it the right way. But, you know, it's like injectors are all different. Some have been injecting for years, some have been injecting for 20 years. So just really do your research is the main thing.
And the big takeaway here, what I'm hearing is, you know, don't be afraid to ask the injector to see the box, to see the hologram, to see the barcode, all of that, because this stuff is going into your face.
And even it's important to, Botox comes as a powder, and so the injector will dilute it with a certain dilution. So some people over dilute, which means when your Botox doesn't work, it could be that it was over diluted. So ask them what they're diluting it with, you know, the norm, you know, how many cc's, and even ask them to do it in front of you so you can tell, you know, that it's the real thing.
And you appreciate that. So
I love it. Yeah, we love it. We love educating our patients.
So when you say what is the right?
Well, it's from 1 cc to 2.5 cc's.
Okay.
But in the cosmetic industry, we typically do 2.5 cc dilution.
Okay.
Never any more than that. If we're doing different areas like hyperhidrosis from your arm sweating, we'll do a 1 cc dilution rate. But on the face, it's typically a 2.5.
So if it's more than that, then that's an alarming.
That and it's just not going to last you as long, or it can spread, and that's where you could get like a droop. Right. You know, so. So yeah, it's just important to go to an experienced injector. You know, just do your research, and it's really safe. All of this stuff is safe in the right hands.
All right. All right. We're going to be talking about some of the topics that have been making headlines when it comes to some of the celebrities and all the things that they're doing to reverse their age or look a lot better at their age. We'll be right back. We were just talking about how fabulous she is as a grandmother. You know, I will tell you, when you have kids, as the kid yourself, we get jealous of our parents now because of the way you were so lenient with the grandkids versus how you were with us growing up.
I mean, I was a kid having kids, and today it's just like, it's just completely different. It changes your life.
Yep, it definitely does. Okay, so let's talk about all the things that have been buzzing in the celeb world, because we're always talking about Botox and fillers and all of that. And celebrities get this stuff, guys. When you look at those magazines and everything, they've had stuff done, which isn't a bad thing. It's just, you know, if you're at home thinking, oh my gosh, I don't look that great, like they've had, you know, things done, and that's okay. Meghan Trainor said, nobody warned me before she went too far with Botox. So take a look at this. This is her not smiling. The 30-year-old pop singer made this cheerful comeback during a recent interview, noting that she was now able to smile a little bit. She says the movement is coming back. She shared that information. She said, I got what's called a lip flip. It was my first ever. And if you're thinking, what in the world is a lip flip? Well, Dana Liconi is here. And so can you tell us what a lip flip is? Because it's more than just getting Botox and filler.
That's right. A lip flip is just tiny baby amounts, micro dosing of Botox right here in the upper lip, and it just rolls it up and shows a little bit more pink. A lot of young people do it, or even older people do it to see if they want to be a candidate for lip filler.
Yes.
It only lasts 2 to 4 weeks. And so yeah, if you're ever going to try a lip flip, I mean, it's great. We have probably 10 to 20 patients a day coming in once a month to get that done. you know, just don't do it right before an event. Like if Megan had an event, you know, yeah, I could see where that would be an issue. But you have to get the dosing right. So we always start with low dosing, and we can slowly increase it. So I don't know what happened to her that she got too much, or she just wasn't used to it. But
I'm not sure.
And a lot of people get it too because they get the gummy smile. So you can put like a little Botox right here to kind of relax that.
Oh, that's
or you put it like right here to get the roll up.
Wow. Well,
it's very popular.
Excuse me. I just remembered now talking to you about this. I don't think my sister's watching, but she got that done, and I think she got too much. So I had my first child, Ryan, and she was in the hospital, and there are no pictures of her smiling with Ryan because she had too much.
Oh, no.
Nobody tell, guys, we're all friends. Please don't tell her I share that information, but they're all like these like smize pictures because she couldn't smile. It's true. I just remember that. I should post the pictures too. Totally. I know.
You'll
I'll
be in
show you the
trouble.
picture. I know I will, but you have to be very careful with that. So the goal is to start low, and then you can go
just work
higher
your
too.
way up. Just start with the low dose.
Yeah.
Just go in and tell your injector, hey, let's start light, and then see how it does, and then you can slowly build up.
Definitely.
But it's very safe. I mean, we do it all the time.
Yeah, it's very popular too. Okay, so Brandley Glanville, who is a Real Housewives Beverly Hills celebrity, I guess you could say. So she's committed to fighting for her health nearly 2 years after her trip to Africa changed everything for her. So she's now suffering from what doctors have suggested is a parasite in her face. After visiting countless doctors, the 52-year-old has spent more than $70,000 in an attempt to find an answer to the mystery that's consumed her everyday experience and disfigured her face. And we know Dr. Terry Dubrow, who is also a famous plastic surgeon. I think his wife was on The Real Housewives as well. Says that he's going to help her out. But Dana, what do you think has happened? Because I mean, I know she's had fillers and Botox because she's come out and said that.
Right. I mean, she looks overdone, first of all. But there's a few things that could happen. Richard was trying to explain some of it to me, you know, today. Like sometimes if you get a product injected that has bacteria in it, that could cause that type of reaction. She could have some type of parasite, some type of fungus. But to us, I mean, she's not our patient. We haven't talked to her. We don't know what exactly has happened. She did say she dissolved her filler. She may have been over injected, and that could be from, you know, dissolving it, causing that look. But it looks like it's a little bit more serious than that. Maybe it was a bad product, you know. So no one really knows. They need to really examine that tissue.
The bigger thing that when people see that is like, oh my gosh, can Botox and fillers do this to my face? And that's not true.
No,
and that's what I kind of wanted to get across.
Yeah.
Is, like doing all the things that we said. If you're watching this on Fox Local, go back to our last segment and you'll get some great information on things that you need to look out for, because that should not be happening to your face and your face being disfigured that way.
No.
All right. So this is, I was talking to Dana about Lindsay Lohan, and she says she did it the right way. So Lindsay looks super fabulous. She did share that she's a big fan of facial lasers for clearer, brighter skin, and Morphus 8, which is a microneedling and radiofrequency treatment that can help tighten and firm her skin by encouraging collagen production. And she recently told Allure that she simply takes good care of her skin. Now, first of all, what is Morphus 8? Because I believe you have that as well.
We do.
Okay.
And it's a radio frequency microneedling. It makes little microchannels, and it stimulates a collagen response. And sometimes we'll draw the blood, get the PRP, put it on. It really helps with the collagen production. Those are all great procedures for tightening. It's good for scarring. It's great, and she did everything right. I mean, she is perfectly balanced. Whoever is doing her work, they're an expert. I mean, everything is perfect. So she's doing it right. She's doing it the right way.
Do you think that she's had, because there were other surgeons, I know you're not a surgeon, but that were saying that she had some fat transfer and possibly a facelift?
Well, I mean, it's possible because you can see she did have some fullness here. I mean, we have something called lipodissolve that will sometimes decrease the fat to give you that slimmer look.
Got it.
Or if you're injecting filler, like up in the cheek area, which it looks like she's had some cheek enhancement, that will pull things up a little bit tighter. But perfectly smooth. She looks good. She's, you know, I think that her lips look great. It looks like she did have like a little lip lift or just filler in her lips, but it was done properly.
What's amazing to me is the fact that you don't have to go under the knife to have all this done.
Yeah, it doesn't even hurt.
Right. Okay. I've had.
Oh well.
Okay. And then when you get the lip injections or the lip filler, I've gotten that done before. That was a little painful, but you have numbing cream.
Yeah,
but
use
yes,
numbing
you
cream.
do.
We have nitrous oxide.
Yes, but this is not a walk in the park when it comes to the lip
But
part.
it takes 5 minutes.
No, it's great.
Yeah.
But I'm saying like you will have numbing cream, Botox and stuff. No, that's fine. But because this is such a
The lips
sensitive
are
area,
sensitive,
right?
yeah.
It's funny because I was
But the good news is it lasts a year. So
yes. So you don't have to get it done so often. It's Botox that it's like 4 to 5 months, right?
it's like 3 to 4.
Oh, 3 to 4. Okay. And then the filler is yearly.
Well, if 1 to 2 years, depending on which filler that you use.
Okay. But yeah, Lindsay did it correctly. So I think the natural look, that's all what's in, not the overblown look, right?
Oh, yeah. We are all about looking
Yes.
natural. So, yeah.
So if you had one piece of advice to give our viewers, what would it be?
Do your research, you know, ask to see the product, know what they're injecting, and just tell them that you want a subtle look.
Yes. And then the owners, if they're using the products themselves, that's also a good testament, right?
Yeah, look at the people that.
Yes. when you just go in and be like, what? Okay, everybody looks great.
If you walk in and their face is blown up, leave.
Exactly. All right, Dana. Well, thank you so much for being here.
Thanks for having me.
Great tips, and be sure you go to a great, reputable place, Institute of Anti-Age Institute here in the Houston area. It's awesome. There's so many wonderful places in the Houston area, so be sure, like she said, do your research, and you'll be just fine. We'll see you next time, friends.
Bye.
Bye.